My name is John Stosho. I'm a registered nurse at Munson Medical Center in Traverse City, Michigan. And we are a 32-bed uh, medical unit. What we like to take away from these conferences are just anything new that we can use. For instance, at that NGNA conference that I went to in St. Louis several years ago, there was a ACE unit representative there, and she talked about having ambulator, somebody who walked people on her unit, and it was also mentioned at the Las Vegas one, and we've developed that, and for the last about a year now, we've had two nurse assistants that have become ambulators. They were trained by physical therapy, and I think it's so important. It's something I'm personally passionate about, getting people out of the bed, because the bed is not their friend. That's one of the things we like to say. And just moving around, from what I just heard today, it can really help avoid delirium, or at least head it off as quickly as possible, just get people up and moving around. So that's one innovation that we've put into practice. We've also, there are several of us that are trainers for GRN curriculum, and also GRNA, the GRNA curriculum. I'm personally a speaker for that in the area of function. I think we've really brought, especially our hospitalists, more into focus for this population of people that we serve. We have a little pamphlet that we developed for to help explain delirium, how it can be hospital-induced. In fact, I had a patient just last week that was, this is about her third day in hospital, and she was becoming a little confused, and the family thought it was all just from having a UTI. Well, that had something to do with it, but I told one of the family members about hospital-induced delirium, and she was able to go home and Google it, and she actually believed me then after that, and that patient was walked a lot, and she came out of that pretty quickly, actually. It's a motivating factor for a lot of us. I'm getting choked up because we come to this conference, we're already motivated, and we see that we make a difference, and families tell us that because of our geriatric focus, that we made a difference for their loved ones. And because of that focus, we've been able to retain staff. Excuse me. Prior to that, our unit was known as a high turnover unit. At this point, we have people, new nurses from other units that look for employment opportunities on our floor, and it's a big source of pride.